The Prime Minister, Health Minister and the Director General of Health all declined to be interviewed on Checkpoint tonight, but speaking on behalf of the government today is former Police Commissioner Mike Bush, who is responsible for all the isolation facilities. And he joins me now. Mr Bush, is this mistake on you then?
Hi Lisa, how are you? There was an error in releasing this person, or these two ladies, without giving a test. That will be rectified. We don't know how that occurred. Director General Ashley Blomfield had directed all of his staff to do that. We'll work through how that occurred, but we've got to ensure that it never happens again.
So you've got operational oversight. So does the buck stop with you, or who is responsible for this? Because nobody seems to be putting up their hand.
Yeah, well, I'm certainly putting up my hand to be here and talk to this, because it's really important that New Zealanders have assurance that this is being managed properly.
So is it your mistake? Just to be clear, do you take responsibility for this?
So the point I was coming to was there's been shared accountability up until this point. So Health has had a role, we've had a role. Prime Minister made it very clear to us today that she's going to ensure that Health are an input into this. So I was really interested in Sir David Skegg's commentary before. But as of today, the operational oversight will be accountable going forward.
So you don't know who is to blame because so many people were handling different elements of it. Is that what you're saying?
Well, I think it's quite clear that the Director General of Health had directed his staff to ensure that people who were granted exemptions for compassionate reasons were tested before leaving. He's made that really clear today, I think, in some of his statements. That didn't occur. So I think we've uncovered, we've dealt with that.
Okay, so why weren't these tests given, and why haven't other people been tested? Because it's not just these women. We spoke to a guest at one of the hotels today. They weren't tested on day 3 either. So why not?
No, well, they should have been. It's not good enough. The regime that's being overseen today is to ensure that that does occur. No one in that hotel has been allowed to leave now until they've been tested and their test results have come back and proved negative. I can tell you that Ash has ensured that his testing regime is now complete across that hotel. So they've completed hundreds of tests since yesterday.
Is it just that hotel? Is it just that hotel, or is there the same issue at other isolation facilities as well with testing?
No. The same regime will apply regardless of which hotel or.
Understand the regime applies. Sorry, I do understand that the regime applies to all isolation hotels, but has it been carried out at other hotels, or is the problem restricted to this one hotel?
No, I'm going to assume that it hasn't. If it happened at this one, I'm going to assume it, but until I know otherwise, that it has occurred in other places. But we are working through that as we speak.
So you potentially have a widespread system failure?
No, I'm not saying we did. I'm just saying we should assume that this is not isolated, and we'll be inquiring to ensure that it is before I can tell you otherwise.
Whose responsibility is it to check that these people have had the tests on day 3 and day 12 as per the protocol?
I think Dr. Blomfield's been quite clear on that. It's a health responsibility. There was an expectation by the Health Minister and the Director General of Health. Somehow that's fallen between the gap. There's been a gap. That's not good enough. Dr. Blomfield's made that very clear, and we're going to be working with him to ensure it never occurs again.
Whose responsibility is the guests at different stages of isolation being able to mingle with each other? Who's supposed to control that?
That's absolutely us. Well, the requirements are clearly laid out to them. When we started this managed isolation, people were very, very compliant. They were doing the right thing. Those same expectations are upon every one of those people in managed isolation. But at the same time, there is a responsibility on us to make sure that compliance occurs. So Air Commodore Webb is in Auckland now, looking at one of the facilities, talking to the staff up there to ensure and resource that requirement to ensure that it happens.
So do you accept that guests who shouldn't be mingling have been?
No, we don't yet. We've heard accounts of that, and what we'll be doing is checking CCTV to find out if that did occur. We've spoken to the staff on the ground who say, look, we've been ensuring that everyone is compliant. But when we hear these reports, we'll absolutely look into them.
So what about, you're saying that people, well, you seem to be suggesting that people are no longer as keen to follow the rules. So how compliant are people arriving at the airport? Are some of them trying to give you the slip so they don't have to go into isolation?
No, I think some of the behaviours that we're seeing indicate that people are less compliant and less willing. And part of it is because, under level 4, everyone was in lockdown, the entire country. Now that we're in level 1, people are seeing that freedom. Obviously, they're quite keen to be part of it. We've got to ensure that they're not. This is really, really important that we get this right. It's really important that those people comply, and we're going to have to increase our resource and increase our oversight to ensure that if people aren't willing to do this, if other people are going to put people at risk, we'll be there to make sure they don't.
We've heard reports of people running away at the airport. Have you had that happen?
I'm not aware of people running away at the airport, but if you're telling me that's occurred, that's something I'll look at, but that hasn't reached my ears.
You'll be aware today that a different version of events has surfaced in respect of the 2 women who have since tested positive. Will you be speaking to them again, or will someone be speaking to them again to make sure that you have the facts right about where they've been and who they've seen?
Absolutely. I've watched that account that was given. Yesterday, the 2 women concerned were spoken to by Wellington Regional Health staff. Those staff have returned and have put that to those 2 ladies. We will know sometime this afternoon or this evening the outcome of that conversation. So hang on,
if they've gone to visit them already, surely you know whether they've changed their story.
Well, they might still be there.
Okay, so when...
But we will know, and we will share that.
You'll tell us if there is any variation to what was initially told to you.
At about the same time, we'll be following up on what that may or may not be. Our priority will probably be to follow up and then tell you, because if that is true, we'll want to follow up on that immediately.
Are you able to tell us whether the funeral for their family member is on hold at the moment?
No, I'm not. I'm not able to give you those details about the funeral.
Just before you go, when is this audit going to be completed? Because a lot of people, well, their exemption or the possibility of an exemption is on hold in the meantime. So how long is this going to take?
Look, we'll do this quickly and thoroughly. It'll take a few days, but already we've increased that compliance regime. Already in the last 24 hours, we've brought in more people to make sure this occurs. We've been managing about 3,000 people at a time in quarantine and managed isolation. About 95% of those people are in managed isolation and they know the rules, and the majority are very, very compliant. But we need to increase that investment. So 560 staff have been dedicated to this. So we're looking at increasing that resource.
Appreciate your time this evening. That is the former Police Commissioner Mike Bush, who is responsible for all isolation facilities.